We have had now our founder panel, we've had our industry panel, and now this afternoon we're going to have a panel that's dedicated to advancing our healthy communities with policy research and innovation, and then to come, investment. So really excited for the next two panels. So I'll leave it with you both. And Glenys is online.
Perfect. Hi, everybody. My name is Sarah Howe. I'm the chief executive. No, I'm not. I am the chief. Break the ice. I might. One day. I am the chief operating officer of the Research Institute of St. Joe's Healthcare Hamilton. So we support 200 researchers annually in a myriad of different areas, but we have a number of researchers focused on women's health. So when I was asked to come here to moderate this panel, I was pretty excited. And I have to say, in my former life, I was also supporting research and innovation at York University. So all of this is very close to my heart. Before I get started, sorry, Wendy, give me a second. I just want to say today has been so inspiring. I am 48, and I have spent my life going through different phases and always feeling so alone. And so I just want to thank all of you for coming here today and having this conversation, but also for your hard work and dedication. Whatever areas you're working on, whether you're a founder or you're in the government or you're in academia, this work is so important. And I think not only for us to come together, but for women all over the world, this is going to have a long-lasting impact. So I just wanted to say thank you before we got started. So I am very lucky here to host this panel today, which is called Building Healthy Communities Through Policy and Research and Innovation, and to have two fabulous panelists, Dr. Wendy Cukier, and Dr. Glenys Webster, who is joining us from BC. So before we get started, I really want you to know who you're hearing from. Both of these women are so accomplished, so I'm just going to go through their bios. Dr. Glenys Webster is a white settler who lives with gratitude on the unceded ancestral lands of the Lekwungen people, also known as Victoria, BC. She is the Associate Director of the CIHR Institute of Gender and Health, based at Simon Fraser University in Vancouver. In this role, she collaborates closely with Dr. Angela Kaida and others to drive innovation in sex and gender science and advanced health equity for women, to LGBTQI+ individuals and other populations through strategic investments in health research. She also provides strategic leadership support to the National Women's Health Research Initiative, a first-in-generation federal investment in women's health research in Canada. As an innovative, interdisciplinary, and equity-focused leader, Dr. Webster brings a diverse background in performing arts, scientific research, and policy work to her role. And as a research scientist, she has authored over 40 peer-reviewed publications and has received multiple scholarships, fellowships, and awards. She holds a PhD in environmental epidemiology from the University of British Columbia, where she created and directed the Chemicals, Health, and Pregnancy CHIRP study to examine the health effects of environmental chemical exposures during pregnancy. Her postdoctoral work in Simon Fraser University further investigated the impacts of the endocrine disrupting chemicals on women and children's health, including aspects of child neurodevelopment. She is currently an adjunct professor at SFU's Faculty of Health Science. Keen to bridge the gap between scientific research and policy, Dr. Webster has also held leadership roles in the BC provincial government as the Director of Women's Maternal and Early Childhood Health of the BC Ministry of Health. She led work leading up to the launch of free prescription contraception in BC, the first such policy in Canada. Additionally, she played a key role in cross-disciplinary efforts to provide maternity care, to bring birth closer to home, addressing gender-based violence, and improve access to maternal, child, and public health services during the COVID-19 pandemic. Dr. Wendy Cukier is a professor of entrepreneurship and innovation at Ted Rogers School of Management in Toronto Metropolitan University, and my former professor, so this is kind of neat for me. She has taught entrepreneurship for many years and helped found several startups. She also has written many articles and co-authored the bestseller Innovation Nation, Canadian Leadership from Java to Jurassic Park. Previously the Vice President of Research and Innovation at TMU, formerly Ryerson, she has helped develop the world's top-ranked university-based incubator, the DMZ, and founded a network of incubators across the country, the Incubate Innovate Network of Canada. She is also the founder and academic director of the Diversity Institute at the Toronto Metropolitan University, which has over 100 full-time staff, 100 research associates from around the world, and more than 200 industry partners focused on dimensions of diversity and inclusion in the workforce, future skills, and entrepreneurship. She is the academic director of the Women's Entrepreneurship Knowledge Hub, a national network and accessible digital platform supported by the Government of Canada that addresses the needs of diverse women entrepreneurs across the regions and sectors. She is academic director of the Future Skills Centre, overseeing a comprehensive research agenda and supporting innovative pilot projects. She is also the recipient of many, many different awards, including the YWCA Women of Distinction Award, an International Women's Forum 2020 Women Who Make a Difference Award, 2 Harry Jerome Awards, a Women of Influence Award, as a WXN Top 100 Most Powerful Women Award. She was named one of the 100 alumni who shaped the century by the University of Toronto and was recently awarded the King Charles III Coronation Medal for her significant contributions to Canada, and has also received Canada's Meritorious Service Award as one of the country's highest civilian honors. So, I am going to speak to 2 women who obviously don't sleep.
Just to be clear, 30,000 people got that medal, just saying.
So I'm going to lead today's conversation about research, innovation, and policy because often that is the backbone. That is where ideas start, and if they don't start there, often they come back in order to be validated. So it's a really important part of the ecosystem. Glenys, I'm going to start with you. Maybe you could give us some opening remarks and tell us a bit about the National Women's Health Research Initiative within the Institute of Gender and Health.
Certainly, and thanks everyone so much for having me. I'm just delighted to be joining you today. I hope you can hear me okay. So as mentioned in my bio, I'm the Associate Director at the Institute of Gender and Health. And our institute is co-leading the National Women's Health Research Initiative in partnership with Women in Gender Equality Canada, WAGE, and with funding contributions from the CIHR Strategy for Patient-Oriented Research and several other institutes. So the NWHRI, the National Women's Health Research Initiative, is a historic $26.5 million investment, first in a generation investment in Canadian women's health research. And it was announced in budget 2021. So we're coming to the end of it in about a year and a half. And we've just finished allocating the funds from the 4th and final opportunity within the NWHRI umbrella. So an important thing to note that I think is quite distinctive for the NWHRI is that we use a really broad and inclusive definition of women's health. So it includes research that would be of benefit to cis women as well as non-binary folks and gender diverse peoples. So the NWHRI has 2 main arms. So there's one that's called the Pan-Canadian Women's Health Coalition, and that's really 10 research hubs from across the country and 1 coordinating center. And their role is really knowledge mobilization. So they're focused on ensuring that the knowledge generated through research is reaching those people who need to hear it. That's everyday Canadians, clinicians, decision makers, and making the research really visible and tangible and making sure that it has impact through knowledge mobilization. So that's the Pan-Canadian Women's Health Coalition side of the NWHRI. The other side is called the Innovation Fund. And this is where we're investing directly into research. There have been 2 funding opportunities here. One was 23 one-year biomedical grants that were launched last year. And those were to tackle bold and innovative research questions in chronically underfunded and under-researched areas of women's health. And then the ones that we've just announced last month were 24 teams who received operating grants in translational research, which is healthcare diagnostics, therapeutics and devices, and then healthcare implementation, which is research to remove barriers to access healthcare. So we just launched the final opportunity, announced the winners last month. Very proud of all the different teams that we have across the country and really looking forward to the research results that will come forward in the coming years to impact the health of women across Canada.
Congratulations, that's some amazing work. Are there any projects in particular that have just been funded that you're really excited about that you could share with us?
Yeah, so I'll say they're all exciting, and I don't want to highlight specific projects over others. I invite you to look at the full list that I believe is online. But there are three that stood out to me as being particularly interesting around the issue of endometriosis. So I'm sure that you may have heard this morning in other panels, endometriosis is a condition that affects a very large proportion of women across Canada and has really devastating effects on people's ability to function and work and all the rest. So there are three projects within our 24 that focus on endometriosis screening, diagnostics, and ways to reduce pain in non-invasive methods. So I'm really excited to see that triad of projects coming together over the coming years. And then there are other projects around biomarkers to improve breast cancer screening, really interesting study out of BC on psilocybin-assisted therapy for post-traumatic stress disorder, and many others related to breastfeeding, pregnancy, and beyond. So, I mean, as you know, there are enormous gaps in women's health research across the country, and they go far beyond the ones that we've been able to fund in this round of the NWHRI. And something we found very interesting was throughout the peer review process, we heard consistently from peer reviewers that the quality, they were really blown away by the quality of the applications that were coming forward all across the NWHRI. And I think this really speaks to the quality of research and researchers that we have in this country, but also the fact that there's talent and opportunity really left on the table. So I think we're coming out of this NWHRI first round really conscious that there's enormous untapped opportunity on the table and many, many ways that we can build on the momentum of this initial investment.
Thank you, Glenys. And for all of you founders, I mean, this could be a really good place for you to start to look, see the projects that have been funded and the researchers that are working in these areas. And it may be an opportunity to reach out and see if there's time for collaboration. Our next question for Wendy. You hold many leadership roles, but I am interested to learn more about the Diversity Institute. So maybe you can open your remarks and tell us a little bit about the Institute and what you do there.
Sure. So my work on gender really started after the Montreal Massacre, and I got involved in a number of projects related to violence against women on the one hand, and women in technology on the other hand. So when the Diversity Institute first started, its focus was primarily on women in science and technology, and then it broadened to consider other equity-deserving groups. And we're in the business school. So the focus of the work that we do is, of course, grounded in a commitment to human rights and equity and social justice. But it's very much tied to the idea that organizations will actually achieve their goals if they embrace equity, diversity, and inclusion. And we heard a lot today, I think, about how ignoring gender is really at your peril. And so we have a lot of projects, that were previously mentioned, but I think some of the things that we're working on that are maybe most relevant to the audience here as they intersect with health are looking first at the research, the science, technology, and innovation ecosystem, and trying to understand where bias is embedded. And I'll come back and talk about that in a moment. The second stream is around supporting entrepreneurs, particularly women entrepreneurs, and looking at the barriers that they face and the interventions that are required. The third area is really around healthcare institutions and equity, diversity, and inclusion practices, both internally, so looking at how staff are treated and how organizations can build more inclusive environments, but also in terms of healthcare delivery, because we know that there are huge gaps, and every single person in this room probably has a story. The Women Entrepreneurship Knowledge Hub is part of Canada's whole of government strategy around women entrepreneurship. And I sort of view women entrepreneurship in the same way I view lady doctors, right? So when I was growing up, there were doctors and there were lady doctors. And now there are just doctors, and in fact, there are more doctors who are women than are men. And right now, women entrepreneurs are still treated as a separate group requiring separate attention, and very big supporter of those investments. At the same time, I think what we need to work towards is an ecosystem that levels the playing field, because the government of Canada has invested about $8 billion specifically in women entrepreneurs, which is fantastic. But it's a drop in the bucket of the broader investments they make in economic development, in innovation, the $22 billion they spend every year on procurement, et cetera, et cetera. So if we think about our longer term goals, short-term Women Entrepreneurship Knowledge Hub is supposed to provide research and evidence to inform the government strategies. But longer term, what we're really focused on is trying to understand the ecosystem, where the barriers are, and how we need to create inclusion. And that's from top to bottom. So it looks at policies, how we think about innovation. Very often we think about innovation in terms of a very narrow set of sectors and activities which tend to exclude women. How we think about entrepreneurship. Do a Google image search on entrepreneur and you get mostly white dudes from Silicon Valley. Celine Dion's one of the richest women in Canada. No one thinks of her as an entrepreneur. So really trying to recast the very way we think about innovation is really, really important, because it affects where the investments are made. Looking at organizational practices. Women get a small fraction of venture capital. They get a small fraction of loans. They get a small fraction, just about everything that is available for entrepreneurs. And rather than creating special funds, and I won't name names, but there are lots of big banks that have the women's entrepreneurship whatever, and yet we know that they give about 2% of their overall funding to women, right? So there are a lot of these very targeted, specialized funds for women entrepreneurs, Black entrepreneurs, 2S LGBTQ+ entrepreneurs, and so on, that are important, but are in some ways a distraction, because what we really have to do is unlock access more broadly. When we look at educational institutions, I teach in entrepreneurship. We have textbooks that only have men. I was the VPRI when we set up the digital media zone, and even the space, the culture, the Friday night whiskey chugging, things were incredibly man-dominated and excluded lots of women. So when women did get in, they didn't feel comfortable, they didn't feel supported, they didn't feel welcome. So rather than setting up a lot of special programs, although I support those because we all need the money, we're really focused on the systems. And when it comes to individuals, there's a lot of focus on fixing the women. Like, how many have been told, oh, you need to improve your financial literacy, right? I have an MBA. I forgot everything I was supposed to know about creating, balanced financial statements and stuff. You actually don't need to know all that stuff. You need to know some fundamental things like what's your product, what's your market, who's going to pay for it, how are you going to make money. But there's a lot of focus often on fixing the women entrepreneurs, and really we have to fix the gatekeepers. We have to challenge the biases that are embedded in a lot of the systems from top to bottom. And when it comes to the foundational work around science and research, I thought the opening presentation was fantastic in terms of really laying bare where some of the biases are. We hear a lot about the stress kills, right? And men have heart attacks and strokes and high blood pressure. How many women in the room have blown out their autoimmune systems? Like 4 times as many women have thyroid disease as men, and no one pays any attention to that stuff at all. We know that, we were talking about cardiac issues earlier today. One of the really awful things I learned when I was chair of the board at Women's College Hospital is, we ring bells and talk about cancer survivor rates, right? The survival rates are based on survival, not dying of cancer. However, dying of the results of chemotherapy, weakening your heart and causing cardiac disease, kind of overlooked. And we can go through lists and lists and lists of automobile safety systems that kill and injure women because they were designed based on car crash dummies. And that's why I think some of the work that CIHR is doing, where they're baking in discussions of sex and gender as part of the research requirements, the research ethic board reviews, and I would add to that, dimensions of race are also important to ensure high quality research. Those are some of the sort of systems level changes that I really think we need to grapple with. And I just wanted to end by saying, maybe partly a function of who was invited, but if this were a health tech event, who would be in the room? Right? And kudos to the guys who are here, but it does strike me as a really strong indication of what the problem is when we know that femtech, all health is 50% femtech, and femtech is such an important sector, and yet it's really hard to get men to pay any attention. I'll stop there because, I could go on.
I did just want to follow up on that, and thank you for that, because that was excellent. There's so much research being done through the Diversity Institute and other initiatives. What are some key knowledge mobilization products that we can really leverage, or you have leveraged through the Diversity Institute, to get the word out, to get the information into the hands of people that need it?
How many people in the room have ever called, written, or met their member of parliament? Pretty good. I would say that political mobilization on this stuff is absolutely key, and I really agree, especially with the horrifyingly changing context we are all in, where wokeness is a bad word. I think we really have to double down on things like the economic impacts and multiplier effects. And one of the projects, I was so furious. No, sorry. There are people in the room who will tell on me. But one day, the government of Ontario announced that it was investing $5 million in women and equity-deserving entrepreneurs. And it was the same day it announced $17 million for the Perimeter Institute in theoretical physics. We look at the investments in electric vehicles, right? And do the math, but the cost per job is about $1 million or something. I forget. It was $500 million, and we're going to create 300 long-time jobs. Any of you know Corrales, formerly SheEO? Okay, so SheEO can show the numbers. $10 million invested in women in interest-free loans, 92% repayment rate, total net $800,000 investment created 1,000 jobs. And every single one of the ventures contributed to the Sustainable Development Goals. So this stuff makes me mad. I'm not an economist. I've forgotten more than I ever knew about economics, but I know economists. So I went and got myself an economist, a guy named Morley Gunderson at the University of Toronto. And I said, you know, the auto workers have done a really good job of showing the multiplier effects. I grew up in a GM town. GM, you know, lays people off. Oh, every hairdressers will go out of business. And, you know, it has these 7 for 1 was the factor that they showed. And I said, Morley, I need a multiplier effect for women entrepreneurs, right? And that's the kind of stuff that we're trying to do to really reframe the discussion. During COVID, we were able to show, for example, that 80% of women entrepreneurs are self-employed because a lot of women enter entrepreneurship with a side gig. They don't take the same pathway as men. And yet all the COVID relief programs were designed to support small, medium enterprises with at least one employee. We're able to go to the government and say you need to refine your eligibility requirements. So that for me, like I'm sort of an okay researcher. I get lots of money and stuff. But what I'm really interested in is driving change at the policy and organizational level. And that's where I think our research has impact.
Thank you. And on that note, Glenys, you touched on before, and Wendy did as well, the policies at CIHR. And I know in 2013, CIHR put forth a guideline, if you will, and I'll get the title wrong, but maybe you could speak to it, about including women in research. So maybe you could speak a little bit to the policies that CIHR has, including that one.
Yeah, thank you. Thanks, Wendy, for bringing up the CIHR policy in this area. So, you know, many years ago, my predecessors led this work to make sure that sex and gender considerations were fully embedded into the project grant competition, which is our core twice annual competition at CIHR, which is investigator-led science. It's not the institutes pushing out priorities, it's investigator-led science. And so, you know, as you've been talking about all morning, for much of research history, research has been done on male cells, male animals, male bodies. Devices have been modeled on male bodies, and often then they're extrapolated to women, and we get things wrong, and that can create harm and can even lead to death. And CIHR realized that how women are affected differently can't just be left to a small group of researchers in a niche area, and that the whole research ecosystem needed to take responsibility for women's health and just overall thinking about sex and gender and intersectional, other intersectional identities like race, age, socioeconomic status, et cetera, as well. You know, every question that you can ask in health research has some kind of connection to sex and gender. Maybe that's a little overstated. Nearly every scientific question you can ask, you know, Alzheimer's disease, chronic pain, cardiovascular health, how to build healthy cities, all that kind of stuff. So back in 2010, actually it was, CIHR implemented a policy that in all project grant competitions, all applicants have to fill out a box that talks about how sex and gender considerations are considered in their research. And then if not, a couple of years later, another box was added that if researchers said that sex and gender was not applicable, they had to justify why it was not applicable. And then a few years later, training was given to peer reviewers, and peer reviewers were asked to, throughout their review, assess whether sex and gender considerations were taken into account and whether that strengthened the application. And we know that from research that's been done, you know, after this process, that people who include sex and gender, when it's identified as a strength by peer reviewers, their funding scores are higher and they are more likely to get funded. So it's an example of a policy that has had an effect across the whole health research ecosystem. there are still challenges. We still don't mandate people to report their results by sex and gender. There are movements through certain journals and SAGR guidelines, et cetera, to have that happen more often. So there's still lots of work to do. But CIHR actually has been named as the global leader in incorporating sex and gender into policy around the world in a science article. So again, Canada has shown a lot of leadership in this area. People are looking to CIHR and our institute for guidance on how to do this elsewhere. But that policy was very important, and we still have a long way to go.
And you've got a really good course. I failed it the first time, I will admit. But for anyone who's doing research, it's great.
And Glenys,
Yeah. Thanks, and thanks Wendy again for the prompt. So another thing that CIHR has implemented for Project Grant is there are 3 sex and gender online modules that Wendy was just referring to. And so to be able to apply for Project Grant, you need to have completed, the principal investigator needs to have completed at least one of those and attach the certificate of completion. I'll just say that we're now in the process of actually re-envisioning those modules because sex and gender science has come a long way in the last 15 years. So, stay tuned for new and better training. But that was also a very important policy change at CIHR that's helped to drive change across the whole health research ecosystem.
And could you maybe just speak a little bit about that change? I mean, with these policies, with this training, what are the different aspects of research that you're seeing? What has been the practical implications?
Sorry, the question was, what are we seeing as a result of those policies?
Yeah, as far as the practical research, the research that's coming in now, are you seeing a change since you implemented the policies and the training?
Yeah, so I don't have the statistic in front of me, but I know, I think there's been a great increase in the number of applications. I think it's up from about 20% up to about 80 or 90% who include sex and gender in the application phase. So that's a huge increase over the span of 10, 15 years. I think the opportunity we have now is to make sure that it's not just what's in the application, but it's also what's coming out the other end. So in the reporting, making sure that folks are required through mechanisms that are possible to report the results by sex and gender, wherever possible. So we've come a long way. There's still a lot of opportunity ahead.
Yeah, and referring to Wendy's previous comments, hopefully one day it's not necessary. Hopefully one day it just is incorporated into the research applications, the research projects, and the research outputs.
Absolutely, and maybe I'll just say one of the most exciting examples. We have a wonderful scientist on our institute advisory board called Jeff Mogul, who's a pain researcher and biomedical researcher, and he's often says that before this policy came into effect, he hadn't really thought that looking at sex-based analysis really was applicable to his field of research. But lo and behold, when he decided to look at his results based by sex, he ended up discovering a very profound thing, that chronic pain, the physiology of chronic pain is actually different in male and female mice, and hence also possibly in male and female humans. And so he says that, for 40 years, they've been studying chronic pain, but chronic pain in men. And there's a whole new realm of opportunity right now to really look at sex-based differences and open up new discoveries in women. And he says when he goes to conferences now, most of the abstracts, most of the posters, most of the talks are talking about exciting new sex-based differences in chronic pain. So it's, if you look, you find amazing discoveries. And, really strong message that we have at IGH, Institute of Gender and Health, is that incorporating sex and gender into science makes it better. It's better quality science. And if you don't look and incorporate and think about those considerations, you're actually leaving discoveries on the table for someone else to discover.
Thank you, and I couldn't agree more. That's amazing, and I love the practical example. Wendy, How do we make sure that investment in women's health becomes mainstream? And how crucial is it is it to incorporate intersectionality in creating the business case for investment?
Yeah, thanks for those questions. So again, the challenge in doing this work when you're trying to drive change is not preaching to the choir, right? How many people in this room think sex and gender are important, right? And so I'm in a business school. I'm really interested. Obviously, I have commitments. I have the credentials. I'm committed to social justice. I'm committed to gender equity. But I want to be successful. And so it's really important, in my view, to always think about the audience and the messenger, and who it is that is going to get the message through. So I very often, are any of you old enough to remember Moonlighting? I brought this example up, right? Candice Bergen was the brains, but she used Bruce Willis because everyone was expecting a dude as a private investigator. And so when I think about some of the audiences that we have to get with the program, you know, the vice presidents of research and innovation across the country, the VCs, the bankers, the politicians, the Minister of Innovation, Science, and Economic Development. We have to think about what things are important to them and how to frame this issue in those ways. And that's why I really loved the presentation this morning and the focus on the economic impacts. And I would just add to it, not only are the very straightforward economic impacts, it's a huge market opportunity, it's a huge, if you look at opportunity costs and absenteeism costs and illness costs, healthcare costs, it's a huge value add for the economy. And frankly, if you look at the value of unpaid work of women and the fact that if you take a woman out with illness, there are a lot of other people affected. Like, you can start to map that and, in my view, show the same kind of, quote, multiplier effects we saw in the auto industry around these investments. But you've got to get the arguments framed in a way the audience will buy it. And I think we need allies. Like, thank you to the men in the room. We need more who are going to make these arguments. The other thing I will say is the intersectional perspective is absolutely, absolutely critical. And we did a study of women in leadership roles in Toronto, for example. This is what really crystallized it for me. And what we found was women were underrepresented in leadership roles. Kelsey Priest, it was, like 35%, even though we're 50% in the population. Racialized women were outnumbered 12-1 by white women, even though racialized women are half the population in the GTA. When we look at health and health research, one of the big eye-openers for me, when I was at Women's College Hospital, was genetic research that was being done around breast cancer. And Ashkenazi Jewish women have always been identified as a high-risk category. We get free access to testing if we have whatever. But what came out is that had a lot to do with the bias in the sampling of the testing that was done because of socioeconomic status. And in fact, there were populations of Black women in particular who had much higher risk levels, but they had never been part of the studies. And I don't know, do any of you know Kwame McKenzie at the Wellesley Institute? He has some awesome research on COVID vaccination, who was affected, and how the absence of a critical race theory perspective on the vaccination process resulted in more Black people dying. And when they corrected that, when they took into account distrust of institutions and the history of slavery and all of the things that Black people in Canada face that we don't talk about because we think we're the Underground Railroad, it had a profound impact on inoculation rates and reduced infections in that community. So every single argument you've heard here today about women, you can apply to the 2S LGBTQ plus community. Gay women have horrible health outcomes around reproductive issues and cancers and so on for a whole variety of reasons. You can apply it to racialized communities, especially the Black community, Indigenous peoples, and persons with disabilities. So I think just as we need allies, we need to be allies for other groups, and it's same arguments. There's money there, there's impact, and for sure, it's how we do a better job.
Thank you for that. I'm now going to move to the iPad section of this panel. I have questions, and I'll pose them to both of you, and you can, both of you can answer, or one of you can answer. First off, can you please tell us a bit about the need for foundational science and research needed to advance women's health?
Punt that to the scientists.
Yeah, I mean, I think, so you're talking about sort of basic biomedical science, is that the question?
I think where are you seeing the gaps, and where do we need to go in order to further that?
I would say the gaps are all across the spectrum of research. So we have, as I mentioned with that example with chronic pain, there are basic physiological biomedical discoveries that we need to probe to better understand the differences between male and female bodies. I think the opportunities there are incredible. The biomedical, when we had our biomedical grants for the NWHRI, that was particularly where we saw application pressure was very, very high. The quality was very, very high of those applications, and we were only able to fund a small subset. So there's a lot of exciting science that's left to be done there. But we need to be looking all across what we call at CIHR the 4 pillars of health research. So we have biomedical, we have clinical. You know, as Wendy mentioned, there are barriers for people, I think Wendy mentioned, barriers for people getting into see clinicians for services, right? There are, doctors are making prescriptions and making recommendations to patients without a solid research backing sometimes for how diseases present or screened or diagnosed or roll out differently in women versus men. There are many, many conditions that are highly prevalent among women where we know very, very little, either things that only happen in women like menopause and menstruation, or female bodies, I should say, and then other things that are highly, highly prevalent in women like Alzheimer's disease, like autoimmune conditions that Wendy referenced earlier, anxiety disorders, depression, migraines. There's so many understudied diseases. And then another pillar is the health system itself. So how do we make sure that the entire system is being friendly to women's health? How do we make sure there are enough doctors, there are enough midwives, that pharmacists can help in the rollout of free prescription contraception? How do we make sure people have access in rural areas, maybe through telemedicine? Lots of opportunity there. And then finally, in the population and public health pillar, also incredible opportunity, often all across these spaces, but that intersectionality lens where you're really probing deeply into multiple identities that overlap and create different experiences of health, all the way from prevention to screening and diagnosis, accessing healthcare and other sort of social factors. So a long-winded answer, but I think we have opportunity everywhere. And we just need to grease the wheels and roll up our sleeves and get to it.
And I'm a big proponent of applied research because that's more what I do. But I remember John Poliani, the Nobel Prize winner in physics, and also big peace activist, that's actually why I love him, who talked about how techniques for silicon chip manufacturing came from fundamental research in lobster, the crustacean, ophthalmology, right? Because something about the way the lobster's eyes function became useful in manufacturing processes. And I only mention that because fundamental science is fundamental, and often we don't know where it will lead, and often we don't see the connections. So you have to invest in all stages.
Thank you for that. Do we have time for one more?
I want to say yes if it's a quick or easy.
All right, well, here we go. Be quick. What is one statistic that frustrates you and you would like to change? Maybe that wasn't quick.
Well, 80% of women entrepreneurs are self-employed. So, there are 110,000 majority owners of SMEs who are women, which is great, but there are 1 million self-employed women, and there's almost no support for them. And they are the pathway very often to the SME owners.
I would say, just bringing it back, I think, to your opening presentation this morning that I wish I could have been in the room for, that closing the women's health gap is a $1 trillion opportunity globally. And so no matter which way you look at it, from an equity perspective, from a compassion perspective, from an economic perspective, there's an imperative for us to do this work. And so again, what's stopping us? Let's get going.
Just a great big thank you to both of you.